Come in.
Hello.
Hello. Hello. What's your name?
Hi, I'm Anna.
How old are you?
I'm 22.
And why are you here in ophthalmology?
Because I have since some days like a swelling in my eye. It's hurting and it's coming some pus out of it.
So three days ago actually.
Some days, but also previous time you have the same symptoms, the same
Yeah,
complaints?
she suffers from it actually since few years.
Few years.
Yeah.
It's a mixture of conjunctivitis, I think. I have like chronic every time.
Uh-huh.
Okay, and do you have any other diseases or complaints?
Yeah, I was diagnosed with systemic lupus erythematosus some years ago.
Yeah.
But it's in control, under control. And
What do you mean with under control? Like, what kind of medication did you take for it?
So my sister's taking antibiotics, clindamycin and amoxicillin.
This is for the conjunctivitis, you mean?
Mm-hmm.
Okay, and for the lupus?
oh, so I think I have it here.
Yeah, she cannot pronounce it. It's a glucocorticosteroids.
Yeah.
Yeah.
Okay. And you're still on it, or?
I take it regularly.
Okay, okay.
Okay, then let's make a rapid physical examination and then we will see what is our thoughts and the
When
differential
you
diagnosis.
press on it, it's hurting. So
Really?
Yeah.
Okay. Mm-hmm. Here also? In this
more on
side?
the left side.
Mm-hmm. Okay.
Okay, what about lenses? Do you use lenses?
Yes, I take them out in the night
Okay.
Mhm.
because there is so much fluid-like symptoms.
Yeah, this
in
is
the
She's
the-
also
eye.
taking good care of it.
Yeah, this is
Yeah.
the right way, but
Yeah.
what about the cleaning of
Yes.
lenses?
Probably because you have
Yeah.
chronic conjunctivitis and it's usually caused by a bad hygiene of the
Yeah.
lenses. It's
Okay.
very typical.
Okay.
Yeah.
But we also are thinking about some chronic disease in the lacrimal duct.
Yeah,
Mhm.
we
Is
should
it-
rule out other things.
Yeah.
Yeah.
Like we have to rule out, for example, sarcoidosis, but you have one of the risk factors that is systemic lupus erythematosus that is also related with this disease that is called chronic Dacriocystitis. The main problem of this is like the only treatment is surgery. We don't have any conservative
really?
treatment. Yeah.
Okay.
But don't worry, like it's a very usual surgery. We perform it very usually, and it usually have a very nice result.
And
So
does she need general anesthesia or
yes,
local
she will
one?
need general anesthesia.
Okay.
And
How many days I have to stay in the hospital after the surgery?
you don't need to stay so much. Maybe like 3-4 days, maybe.
So no,
Yeah.
I have to go to work. I don't
Yeah, but
have
yeah, but you need to do it. Like
And
you
is
can't
there
continue with this.
regional anesthesia may be possible.
Yeah, okay, you don't have so many risk factors, so maybe we'll talk with the anesthesiologist and ask, like, but in general, it will be general anesthesia, and the main complication that you can have is some hemorrhage and infection, but it's not very typical. And also, after the surgery, 2 weeks after it, you will have swelling and probably some pain, some hematoma, and then we have to remove also a tube, because we will put a tube into your lacrimal duct to make a better drainage of the tears, because this is the main problem. Like the tears are not going like in a normal way, so they are accumulating and they can produce chronic conjunctivitis. So we have to make the surgery as soon as possible.
Okay.
Okay.
And is there a possibility that you damage any nerves or something?
There's always a risk. Basically, there are 3 nerves that can be damaged during this procedure, but we never, like, we cannot say never, but almost never we didn't perform like we didn't have that kind of complaint, that kind of side effects of the surgery. So it's very secure surgery, so don't worry.
Okay, sounds good.
Okay.
And
Do you have any other questions? Like,
when can we do the operation? Because it's like very
This is the only problem.
acute.
We are unfortunately we are completely full for the next 3 months, and
But
so
I think it's an emergency.
Yeah,
because
I-
yeah, we
Of course,
will
I
try to find the time as soon as possible.